There's a secret spreading through America's hospitals, not in conference rooms, not in medical journals, but in whispered conversations between doctors in surgical lounges, at medical conferences, in late-night phone calls between colleagues who've known each other for decades. And it sounds something like this. We sent her to Manila, pause, and it was the best decision we ever made. What if I told you that right now, at this very moment, some of America's most successful physicians, cardiologists, neurologists, trauma surgeons who've spent their entire careers climbing the ladder of medical prestige are making a choice that would have been unthinkable just 10 years ago? They're sending their own children 8,000 miles away from Johns Hopkins, from Stanford, from Harvard Medical School, and they're sending them to study medicine in the Philippines. Yes, that Philippines, the archipelago nation known more for its beaches, its mangoes, and its overseas workers than for producing the next generation of American doctors. But here's what nobody's talking about. They're not just doing this quietly anymore. They're becoming advocates, believers. And once you hear why, you might become one too. To understand why this is happening, we need to rewind to 2019, before the pandemic, before everything changed. Dr. Jennifer Park was living the dream. Stanford undergraduate, Cornell Medical School, cardiology fellowship at Massachusetts General Hospital. She had the resume that made other doctors jealous. She also had something else. A daughter named Sarah, brilliant, pre-med, 3.9 GPA, and completely, utterly broken. Sarah's story isn't unique. It's the story being lived out in dorm rooms and libraries across America right now. She'd spent 4 years in pre-med hell, organic chemistry courses designed to weed people out, MCAT prep that cost more than a used car, summers sacrificed for unpaid internships, volunteer work carefully curated for application essays, and through it all, a single crushing truth. It might not be enough. In 2019, American medical schools received over 53,000 applications. They accepted roughly 21,000 students. That's a 40% acceptance rate. Better odds than the lottery, worse odds than getting into dental school. But here's the part that doesn't make the statistics: the psychological cost. Sarah was taking antidepressants by junior year. She'd stopped painting, the one thing she loved that had nothing to do with medicine. She barely called home anymore because every conversation felt like an evaluation. One night, Dr. Park got a call from Sarah's roommate. Sarah was having a panic attack so severe she couldn't breathe. The trigger? She'd gotten a B+ on a biochemistry midterm. A B+. That night, driving 6 hours through the rain to reach her daughter, Dr. Jennifer Park started asking herself a question she'd never allowed before. What if we got this all wrong? The conversation that changed everything happened 3 weeks later in the most unexpected place: a hospital cafeteria in Boston. Dr. Park was grabbing coffee when she ran into Dr. Ramon Santos, a Filipino-American colleague she'd known for years. They made small talk. He asked about Sarah, and when Dr. Park mentioned she'd taken a gap year to figure things out, Dr. Santos said something that stopped her mid-sip. You know, my nephew just finished his 3rd year at University of Santo Tomas in Manila. He's going to do his residency here in Boston. Probably end up at better hospital than most Harvard med grads. Dr. Park laughed. Wait, he went to medical school in the Philippines? How does that even work? What followed was a 45-minute conversation that Dr. Park later described as like finding out there's been a door behind the painting this whole time and you just never thought to look. Dr. Santos explained, the Philippines has been training doctors for over a century. Many of their medical schools are U.S. accredited. The curriculum is often taught in English. Clinical rotations start in the 1st year, not the 3rd like in America. And the cost, about $8,000 to $15,000 per year, all inclusive. Compare that to American medical schools averaging $60,000 to $90,000 per year. But it wasn't the money that caught Dr. Park's attention. It was something Dr. Santos said almost as an afterthought. The thing is, Jennifer, they don't just teach him anatomy and pharmacology. They taught him to see people again. He came back different, better. That night, Dr. Park did something she'd never done in 20 years of medical practice. She questioned whether the American system, the same system that had made her, was really the only way. 3 months later, Dr. Park and Sarah were on a plane to Manila. The humidity hit them like a wall. The traffic looked like organized chaos. The Philippines, to American eyes used to structure and order, felt simultaneously overwhelming and strangely alive. Their first stop was the University of the East Ramon Magsaysay Memorial Medical Center. Not a name that rolls off the tongue, not a campus that belonged on Instagram, just a solid, functioning medical school with a 60-year track record of producing competent doctors. Sarah's first impression? It looked normal, like disappointingly normal. I guess I was expecting something either perfect or terrible. But then came the interview with admissions. And this is where something shifted. In America, Sarah had interviewed at 3 medical schools. Each interview was the same. Polished questions about her achievements, her goals, her unique perspective. Performances where everyone knew the script. Here the interview was different. The dean, Dr. Mendoza, was a woman in her 60s with sharp eyes and laugh lines. She didn't ask about Sarah's GPA. She didn't ask about her MCAT score. She asked, "Why do you want to be a doctor?" Sarah gave her rehearsed answer, the one about helping people and being passionate about medicine. Dr. Mendoza smiled not unkindly. "That's a nice answer. Now tell me the real one." Sarah looked at her mother. Dr. Park nodded. And for the first time in 4 years, Sarah told the truth. "I don't know anymore. I used to know. I wanted to help people like my grandmother, who died of diabetes complications because she couldn't afford proper care. But somewhere in pre-med, I forgot about her. I just started chasing grades. And now I don't know if I want this because I want it, or because I've already given up so much that I can't turn back." There was a long silence. Then Dr. Mendoza said, "Good, that's honest. That's something we can work with. Sarah, let me tell you what we do here. We don't just teach you to be a doctor. We remind you why you wanted to be one in the first place." Sarah started crying, not from sadness, from relief. Dr. Park, watching from across the table, felt something crack open in her chest. The same protective shell she'd built during her own medical training, when she learned that showing emotion was weakness. 2 weeks later, Sarah enrolled. Sarah's first year was nothing like pre-med. The academics were rigorous. Make no mistake, anatomy was anatomy. Biochemistry was biochemistry. The Philippines doesn't lower standards. If anything, the volume of material is intense. But the environment was different in ways that are hard to quantify. In America, medical education has become a Darwinian process. The assumption is that if you can't handle the pressure, you shouldn't be a doctor. Stress becomes a feature, not a bug. In the Philippines, at least at schools like Sarah's, the approach was different, still demanding, still exhausting, but fundamentally humane. Sarah's anatomy professor, Dr. Cruz, started the first day of cadaver lab with a prayer. Not performative, just a moment of silence to honor the person who had donated their body. "This person wanted to teach you," he said quietly. "Don't dishonor that gift." In week 3, Sarah had a breakdown. She'd failed her first pharmacology quiz, not failed by American standards, she got a 72%, but failed by her own internalized expectations. She went to her dormitory expecting to cry alone. Instead, her roommate Anna, a Filipino student, took one look at her and said, "Get dressed. We're going out." They ended up at a tiny karaoke bar near the school. Anna ordered them sisig and San Miguel beer. And for the next 2 hours, Sarah sang, terribly, joyfully, surrounded by medical students from 5 different countries who were all equally exhausted and equally committed. When they returned to campus at midnight, Anna said something Sarah would remember forever. You know what kills more doctors than anything? Not failure, loneliness. Here, we don't let people be alone. But the real transformation came during clinical rotations. American medical students typically don't get significant patient contact until their third year. In the Philippines, Sarah was in hospitals by month 6, not just observing, participating. Her first rural rotation was in Batangas province, in a hospital that had 2 CT machines, one of which usually wasn't working. No electronic health records. Sometimes the power went out mid-shift. It should have been a disaster. Instead, it was revelatory. Sarah watched a Filipino doctor diagnose appendicitis without a CT scan, using physical examination skills American doctors were starting to forget. She watched nurses improvise IV stands using bed rails. She watched janitors who knew every patient's name. And she watched something else. Doctors who prayed with patients when medicine couldn't help. Families who brought food for the entire ward. A culture where healing wasn't just clinical, it was communal. One night, Sarah assisted in a delivery. Emergency C-section. The power was out. They used flashlights and headlamps. The attending physician, Dr. Reyes, never panicked. Just moved with calm, practiced efficiency. When the baby cried, healthy, loud, the entire room erupted. Nurses, janitors, security guards, even Sarah. Afterward, Dr. Reyes put her hand on Sarah's shoulder. In America, you have all the machines. That's good. That's important. But sometimes having less means you have to be more attentive, more creative, more human. Sarah called her mother that night. "Mom," she said, her voice shaking. "I remember now. I remember why I wanted to do this." Sarah graduated 3 years later. She took the USMLE, the licensing exam for American medical practice, and scored in the 88th percentile. She matched with a residency at Mount Sinai in New York, internal medicine. Her program director later told Dr. Park, "We interview a lot of candidates. Your daughter stood out immediately, not just her scores. Something else, she had this presence, like she'd actually taken care of patients, not just read about them." But Sarah's story isn't an outlier anymore. It's becoming a pattern. Dr. Marcus Chen from Seattle sent his son to Cebu Doctors University. Now he's a surgical resident at UCLA. Dr. Aisha Muhammad from Atlanta sent her daughter to Ateneo School of Medicine. She's now in a psychiatry residency at Johns Hopkins. Yes, Johns Hopkins, the school that rejected her application 4 years earlier. Dr. James Rodriguez from Chicago sent both his children to Philippine medical schools. One just became chief resident at Northwestern. The other is starting a fellowship in pediatric cardiology. The statistics are starting to speak for themselves. Filipino medical schools have trained over 10,000 foreign students in the last decade. Many are Americans. Their USMLE pass rates are comparable to U.S. medical schools. Their residency match rates are rising every year. But more importantly, something else is emerging. These doctors are different. Hospital administrators have started to notice. Patients have started to notice. One nursing supervisor in Boston told me, off the record, "You can tell the ones who trained overseas, not always, but often. They don't just treat the disease, they talk to the person. They remember that medicine is a human profession." So why does this matter? Why should you care about where doctors are trained? Because what's happening in the Philippines is a mirror. It's showing us what American medical education has become and what it's lost. We built a system that produces technically brilliant doctors, but somewhere along the way, we forgot that medicine is not just a science. It's an art, a calling, a deeply human profession that requires not just knowledge, but wisdom, not just skill, but compassion. The Philippines, for all its economic challenges, has preserved something we've let slip away. The understanding that you can't train someone to heal others if you break them first. Dr. Jennifer Park said it best when I interviewed her last month. "I spent my entire career believing that medical education had to be brutal to be effective. That if you coddled students, you'd produce weak doctors. I was wrong. What Sarah learned in the Philippines, both the clinical skills and the humanity, she could have learned in America. But our system doesn't value the humanity part anymore. We say we do. We don't. This isn't about abandoning American medical schools. They're still among the best in the world. But it is about recognizing that we've created a system that's becoming unsustainable, financially, emotionally, and ethically. And until we fix that, families will continue making the choice Dr. Park made, sending their children across the world not to escape American medicine, but to find what American medicine used to be. The Philippines isn't stealing American doctors. It's reminding them what healing actually means. And maybe, just maybe, some of them will bring that lesson back home. If this story challenged the way you think about medical education, about what makes a good doctor, or about where real healing happens, hit that like button and subscribe. Because this is just the beginning of a conversation we need to have about the future of medicine. And in the comments, I want to know, if you're a parent, would you send your child to study medicine overseas? If you're a patient, does it matter to you where your doctor trained? Let's talk about it. Because the quiet revolution happening in places like Manila, Cebu, and Davao isn't just about medical school. It's about remembering that before doctors can heal others, they need to be healed themselves. Thank you for watching. And to all the medical students out there, wherever you are, keep going. The world needs healers, not just clinicians, healers.